Welcome and thank you for watching my video today. My name is Andrew Beykovsky, MD. I work in Milwaukee, Wisconsin, and I'm a neurosurgeon. Today I wish to talk to you a little bit about sacroiliac dysfunction. It's a pathology that a lot of people are dealing with right now and probably encompasses somewhere around 15 to 30% of back pain. It's definitely underdiagnosed, and we're going to review a little bit about what it all entails and how we treat it and what your expectations should be. We're going to talk a little bit more about the anatomy of the sacroiliac joint. If this is your spine right here and this is your tailbone or your sacrum, sacrum connects to the ilium. This joint right here is usually what will cause that type of sacroiliac pain that I'm trying to discuss with you today. If you think of your spine as being one single axle carrying all your weight, that axis of weight is basically going to distribute into two segments. It's going to go to the right and to the left, obviously to your legs, but it has to go through that sacroiliac joint. Now the sacroiliac joint typically should not move. It's held by very strong ligaments and muscles typically, and it only allows a certain amount of movement in very special occasions. For example, during pregnancy when these ligaments need to loosen up to open up the pelvic cavity to deliver the baby. Otherwise, this ligament should be nice and static. When the ligaments become incompetent, the joint starts moving and rubbing bone on bone, and that's typically what's going to lead to the pain. So let me focus a little bit in regards to what the classical symptoms of sacroiliac dysfunction are. I think the most typical complaint I get from my patients is they will describe lower back pain, and if you're looking at your back at this level right here, usually the pain can be relatively diffuse, but it's not uncommon that you would try to localize it towards the right or the left side. The pain typically will radiate down to your buttocks and to your thigh and occasionally slightly upward. But the classical pain will start on one side and then radiate sideways to your thigh. The pain can wax and wane. Typically it starts very benignly and you're able to treat it with anti-inflammatories pretty successfully. But as the ligaments continue to weaken, classically the pain will become worse in intensity and you will have periods where the pain will just be so debilitating you won't be able to function normally. Treatment for sacroiliitis or sacroiliac dysfunction can take two routes. The first one classically is going to be a non-surgical or non-operative route. And that's going to include typically medications that you probably have been taking, usually anti-inflammatories. The other thing that usually will help you is some type of massage. Chiropractors would be very good about diagnosing and usually trying to manipulate the joint and getting it back into place. It's not uncommon to see that only being temporary in nature. Now, when the pain is lasting more than expected, you're not responding to the conservative non-surgical treatment, then we have to have the discussion about surgery. The best way is going to be in a minimally invasive way. Rods are the most effective way to go about that right now. Looking at all the research, your outcomes are expected to be somewhere around 85 to 90% with improvement of at least 50% of your pain. Now, what is the procedure about? It's very simple. It's fast. It's a quick recovery, and usually it doesn't require you to not even spend one night in the hospital. It's going to be an incision on the side of the buttocks, usually on the side where you're having the pain. And what we end up doing is basically through guidance of x-rays, placing rods right through that joint and locking the joint into place, allowing it for it to heal properly. And that healing usually will require bone to grow from the sacrum to the ilium. iFuse has provided us with over 30 peer-reviewed studies that demonstrate both the effectiveness and the low complication rate of the procedure. The design is something spectacular. It basically has a triangular shape that is going to minimize any type of motion, and the combination of three of these implants, what we call the SI implants, locking the joint is going to guarantee that it's going to freeze the joint enough time for it to fuse together and for it to heal.
My name is Jennifer and I'm a patient of Dr. Beykovsky's. My journey started back in 2010 where I felt lower back pain, and some of the things I couldn't do was pick up my kids, do the laundry, go for walks. Dr. Beykovsky did confirm that, since I went through all the physical therapy and chiropractic, that surgery would be a recommended option to relieve my SI joint pain. Back in 2014, I had my left side fused, and it did provide me with plenty of relief. And then the following year, I had also my right side fused, and I feel like I have my life back again.
So how do you feel now?
I feel so much better. I feel like I have my life back again. I really do. It was obviously a long journey to get here, but it was definitely worth it.
What was it like before the surgeries?
I couldn't do normal things as laundry. I couldn't pick up my kids. I couldn't cut the grass. So, and now I can do all those things. So.
And I've had some of those patients even 50 years with that pain that we were able to help them, and it's changed their life completely. When 50 years of their life, they basically spent trying to figure out how they were going to do their chores at home, how they were going to attend to vacations in their children's, how they were going to change their different behaviors doing work. So this has really changed a lot of people's lives.
Yeah. So, thank you.
Good. Would you recommend this procedure?
I would absolutely recommend it. I mean, it's worth it, and I would absolutely recommend it.
Good. Well, thank you very much. I appreciate that very much.